Good morning, everybody. I'm Chris Lyford. Thanks for joining us again for another edition of our Facebook Live interviews here at the 2019 Networker Symposium. I'm joined today by Lisa Ferentz of the Ferentz Institute in Baltimore, Maryland. Lisa, thank you so much for joining us.
My pleasure.
Now, Lisa actually she runs a continuing education program for adults. She's also in private practice. Lisa's going to tell us a little bit about her work in trauma as a trauma specialist. So, Lisa, tell me a little bit about expressive modalities and parts work and how it connects to this idea of self-compassion.
Sure. So what we now know in working with trauma survivors is that so much of their experience is not stored in the languaging part of their brain. So once we understood that, it made sense that we had to work with modalities that help to access the visual parts of their brain and the visceral, working with the body. So bringing in art modalities, sand tray, sensory motor psychotherapy, somatic experiencing, anything that allows for movement, connection, you're working with the clients on a much deeper level. So I think that because so many trauma survivors carry this sense of shame, the antidote to that is self-compassion. But if you ask clients to just talk to themselves in loving and affirming ways, that often feels kind of counterintuitive. It doesn't really resonate for them. So having them draw a safe place image or having draw the part of themselves that they can bring some comfort to. When they talk about something really distressing, having them put a hand on their heart and kind of move and gently soothe and rock themselves, these become deeper ways that they can begin to install that sense of compassion and worth and love. And I think it gets metabolized more deeply, and you integrate it more thoroughly when you're not just talking about it with words. So any creative modality, I think, is almost necessary now in our work with trauma.
Great. Anybody who's interested in getting into this line of work, an aspiring trauma therapist, maybe somebody who's not too familiar with the ideas we're talking about today, what would you recommend that they do? What's new in the field that they really need to know about as they enter the stage?
So I think one of the most exciting things about working specifically with trauma is understanding the impact it has on the brain. So, and that we can look at that from two perspectives. It's understanding the adverse ways in which trauma can impact the brain so that we can actually do some psychoeducation and normalize for our clients that the sleep disturbance, the eating disturbance, the hypervigilance, the fight, flight, freeze, all of the different facets of trauma actually make sense because trauma has impacted their brains. But the upside to that that's really exciting is the concept of neuroplasticity. That our brains are malleable and they're capable of growth and change and regeneration until the day we die. And we know in our field that we can introduce things like humor and social connection and novelty and exercise and good nutrition and good sleep, and all of those things are going to help to promote neuroplasticity. That's your best friend as a trauma specialist, is knowing that we can bring that back on board for our clients. It gives the work tremendous hope.
Fantastic. Lisa, thank you so much for joining us. We
My
really
pleasure.
appreciate it. For all of you out there, please check back. We're going to be doing more Facebook Live interviews today. Until then, signing off.